This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Our guest this morning, Briana Bishop, Sepsis and Stroke Coordinator with Mon Health. Good morning, Briana.
Good morning.
And we have Krystal Atkinson, Mon Health Medical Center CAO and Mon Health System Chief Nursing Executive. Good morning, Krystal.
Good morning to you.
Well, guys, thanks for taking a few minutes this morning. We're going to get into the topic of Acute Stroke Ready coming up in just a few minutes, but we always like to learn a little bit more about our guest before we dive into the topic. So, Briana, we'll start with you. Tell us a little bit about yourself, where you're from, your background, and how you ended up with Mon Health.
All right. So I am a born and raised Preston County resident, lifelong, and I went to school at West Liberty University, graduated in 2012. I've been worked at the Mon Health Memorial Hospital prior to coming to Mon Health approximately 2.5 years ago. I'm incredibly excited and thankful to be part of the Mon Health team. And I'm not sure exactly what brought me to Mon Health, but something made me want to grow and learn more about Mon Health and becoming a nurse, mostly an emergency department nurse by background, and now working as a Sepsis and Stroke Coordinator.
And Krystal, you're a friend of the show, obviously, been on several times, but just remind folks of your background.
Yeah, absolutely. Thanks so much. So I am a native of Richmond, Virginia, and as I am told by my friends here, I have now come and now live in the best Virginia. So I've been a nurse for over 30 years. I'm very proud to call Mon Health my home. Recently, I came from Portsmouth, New Hampshire, and I've been here a little over 2 years. Very excited to call Mon Health my home.
And Briana, I just wanted to ask you your title of Sepsis and Stroke Coordinator. Can you explain to folks what your role encompasses?
Yeah, absolutely. I will focus on the stroke portion first.
Sure.
One of the things I do is make sure that we are following the latest guidelines and best practices in terms of treatment of stroke, making sure we are striving to meet those measures set forth by the accrediting bodies, as well as aligning with the best practices. And very similar with sepsis as well, driving those practices to ensure that we are compliant with those standards and metrics as much as we can be.
Now, you've kind of touched on it, hinted, but you do have some exciting news to share today. What do you want to announce?
Mon Health Medical Center is very excited to announce that we have earned the gold seal of approval from the Joint Commission, our accreditation body, and we have achieved the certification of Acute Stroke Ready Hospital. So we're very excited to announce that and share that with our community.
So what does that mean to the patient or the listener tuning in this morning?
So what that means to our community means that we have proven to our regulatory agency, known as the Joint Commission, that we have the tools, resources, and processes in place readily available so that we can quickly assess and treat an acute stroke 24 hours a day, 7 days a week.
And Krystal, where do you step into this role as far as being ready and prepared to handle stroke patients?
Yeah, so great question. And really, from my perspective, it's having folks like Briana who bring forth an idea and the best practices that are out there, and then providing the support. We've got phenomenal providers. We've got phenomenal nurses, folks in radiology and all types of supporting areas that will provide that immediate care. So, definitely it was a no-brainer when the idea was brought forward for us to be able to go into an area where we can demonstrate that we have the clinical ability to be able to care for these patients and then supporting our nursing and medical directors.
And Briana, what kind of process did Mon Health have to go through to earn this accreditation?
So Mon Health went through a very rigorous, in-depth site visit and review. During this visit, the Joint Commission evaluated our compliance with standards related to the certification standards. That include areas of program management, supporting self-management, and overall how we deliver and facilitate clinical care. So the reviewers took a tour through our designated stroke units, spoke to staff in those areas, and just overall evaluated, what our process looks like, what it would look like from the patient perspective, and just evaluated overall, how we perform based on their standards.
And Briana, can you give us an idea, and obviously each patient has their own individual case and own individual course of care, but can you give us kind of a general idea if a patient, if I bring in a family member, someone who has suffered a stroke, kind of walk us through the process of the treatment and care that they'll receive at Mon Health?
Absolutely. So our patient would present, then our staff is trained to quickly recognize and treat the stroke and stroke-like symptoms. So they would initiate a stroke alert on said patient, and the patient would be, taken immediately to a bed, quickly assessed by a nurse and a provider, and the patient would be very quickly whisked away to the CAT scan for immediate emergent brain imaging. We would consult our neurology specialist to assess the patient to determine if the patient was within the treatment window for maybe a medication known as a clot-busting medication if the stroke is being caused by a blood clot within the brain, or if we need to escalate the patient's care in some other way. That's the very immediate from the door to CAT scan to potential medication administration is the most important steps of a stroke alert.
And Krystal, as the patients are going through this, you've got to communicate with the family members. You're trying to keep them informed and obviously watch for even the most subtle changes in the patient, don't you?
Absolutely. So we have the nursing staff as well as our physicians. As Briana just shared, while the patient is in the CAT scan, that's when we have the opportunity to be able to educate, and we'll keep the patients updated, the patient's families updated at all points.
Talking to Briana Bishop this morning, Sepsis Stroke Coordinator, and Krystal Atkinson, Mon Health Medical Center CAO and Mon Health System Chief Nursing Executive. Mon Health Medical Center earning the Gold Seal of Approval for Acute Stroke Ready Certification. We'll continue our conversation. Got to squeeze in a quick break. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests this morning, Briana Bishop, Sepsis and Stroke Coordinator, Krystal Atkinson, Mon Health Medical Center CAO, and Mon Health System Chief Nursing Executive. Mon Health Medical Center recently receiving the Gold Seal of Approval for Acute Stroke Ready Certification. And Briana, just why is it important to the community to earn these certifications?
These certifications provide a level of distinction to our healthcare facilities, setting us apart. So Mon Health is now one of 3 hospitals in the state of West Virginia with the Acute Stroke Ready Hospital certification. And that just provides, again, a level of distinction and sets us apart and lets our patients and our communities know that we are always ready and available to treat an acute stroke. And we have those resources, standing by 24/7.
And Briana, that's not the only certification the Mon Health Systems facilities have achieved, is it?
That's correct. Mon Health System, Mon Health Preston Memorial also possesses the Acute Stroke Ready certification. They have went through the initial certification as well as the recertification process. And we also have a number of other certifications throughout our health system.
And Krystal, we've talked a lot about these certifications and the importance to the patients, but it's very important to recognize the signs of a stroke, symptoms, so people can identify that quickly and get attention, medical attention, as quickly as possible. So what are the signs that someone may be experiencing a stroke and needs immediate attention?
Yeah, it can. So definitely, we want to make sure that patients have that understanding. Briana will definitely go into the details of that, and it's really easy to identify that by the acronym of BFAST. So I'll turn that over to Briana if you want to go through those letter by letter so people have an understanding of what they're looking for.
Please, Briana, go ahead. What is BFAST?
Certainly. BFAST, like Krystal said, is a quick acronym that you can utilize to quickly and easily recall the signs and symptoms of a stroke. So B being balance. You may notice that the person has a disruption to their balance. They're falling or just not as coordinated as what they normally are. E for eyes. They may complain of blurry vision, double vision, loss of vision, something of that nature. F for face. They may have some type of facial droop, numbness, or tingling. A for arms. One arm may be numb or tingly or not have use of that arm at all. Speech. You're going to notice that their speech is different. Perhaps it is slurred. Perhaps they cannot find the correct word to say to you, or they may not even be able to speak at all. And one way that you can assess for that is have the person, recite a simple phrase to you, such as the sky is blue. And if any of those symptoms are present and evident, the T is for time. It's time to call 911 or time to get to your nearest healthcare facility and seek medical treatment. So one thing we definitely want our community members to know and understand is BFAST, as when a stroke presents, time is of the essence, and time is essentially brain, so we want to be fast.
And Krystal, if you have any suspicion, it's always better to make that call, get checked out. If you have any thought that, hey, maybe my loved one here is having a stroke, there's something off, as Briana just said, time is brain, and there's no reason to wait around.
Absolutely, and the best course of action is to call 911. As many times as we think that we can, put somebody in the car and we can get them to the hospital quicker than an ambulance, the care that the patients can get while they're en route to the hospital is crucial.
Talking to Briana Bishop, Stroke Coordinator, Krystal Atkinson, Mon Health System Chief Nursing Executive, Mon Health Medical Center CAO this morning. And Briana, what do you want listeners to take away from our conversation this morning? What's the most important thing you want them to know?
The most important thing I would like our listeners to take home with them today is just being able to quickly recognizing those signs and symptoms of a potential stroke, so that they can seek medical care as soon as possible. They may be able to greatly impact the life of, a coworker, a friend, a loved one, or just simply somebody behind them in line at the grocery store. So remembering that BFAST balance, eyes, face, arms, speech, time is incredibly important, and that knowing Mon Health Medical Center is always ready and available to help them with any medical emergencies they may be experiencing.
And Briana, I'm not sure how to ask this question quite right, but I'll try. Are there other factors that can increase one's risk for stroke? Does that make sense?
Yeah, absolutely, and that's an excellent question. There are several items that can increase a person's risk for a stroke, such as smoking. Cigarettes is a huge risk factor, as well as uncontrolled diabetes, uncontrolled blood pressure, uncontrolled cholesterol levels. So these are just some of the highest risk factors for a stroke, and so they should seek consultation with their primary care provider to manage those issues to decrease their risk of stroke.
It is such a common refrain almost each and every week on this show, whether we're talking about the topic today, stroke, Well, just about every topic we've come up. If you want to reduce the risk, quit smoking, eat well, exercise, and that will reduce your risk of just so many different ailments that may come back to get you later in life. We are talking to Briana Bishop, Stroke Coordinator for Mon Health, and Krystal Atkinson, Mon Health Medical Center, CAO, Mon Health System Chief Nursing Executive. We got to squeeze in one more quick break. We'll be back to wrap up the conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning, Briana Bishop, Stroke Coordinator, Krystal Atkinson, Mon Health Medical Center, CAO, and Mon Health System Chief Nursing Executive. We got just a couple of minutes left, and Krystal, I'll pitch this one to you. Can you give folks just a quick insight into the aftercare? Just because someone has a stroke doesn't mean that they can't recover. Again, it's all an individual care, but can you give us some idea of what a stroke patient, how you will work with them to try to get them back to as normal of a life as possible?
Absolutely. Certainly depending on the presentation for the patient, whether they require care in the ICU or they require care on our step-down unit. During that process, we have physical therapy, we have occupational therapy that will work with the patient in addition to the doctors and nurses to make sure that if there are deficits, as Briana had clearly outlined above, like with walking or, getting their clothes on, doing simple things like brushing their teeth, we have people in place that will certainly help them while they're in the hospital. As they get to the place of needing less acute care from a hospital setting, our case managers will certainly work with short and long-term care facilities to be able to provide that extended care for them as they go through the rehabilitation process.
And Briana, where can folks go to find more information about the accreditation and stroke awareness?
Our information is available on monhealth.org. And then they're always welcome to give us a call here at the hospital, and we'd be happy to help them in any way that we can.
And if you don't remember anything else from the show today, remember, be fast. Be fast when it comes to recognizing stroke symptoms. Guys, Briana Bishop and Krystal Atkinson, thank you so much for spending a few minutes with us, and congratulations on the latest achievement.
Thanks so much. It was our pleasure.